I'm hoping this impresses upon you that one of the main facets of food allergy testing, IgG, is not helpful and occurs in normal individuals. What the allergy test says I shouldn't eat, I feel fine on. And oh, by the way, there are certain foods I notice disagree with me, and the test says I can eat them. Hey everyone, welcome back. This is Dr. Michael Ruscio. I am a practicing clinician, a clinical researcher, and an adjunct faculty at the University of Bridgeport. And today I have a very alarming case of what happens in functional medicine and what you must be aware of. And I don't mean to be overly alarmist, but as I'll outline for you here, a poor lady, we'll call her Jane, did $2,411 worth of testing to feel worse and develop an eating disorder. What I want to do is weave together for you what testing has no validity or very little utility that you should avoid, and show you the actual tests and evidence, plus juxtapose that with Jane's case so you can see what you should avoid. Because when you're not feeling well, I understand you're looking for any lifeline towards improvement, but you shouldn't fall prey to the false promise that lab tests often make. So let's unpack this so you can understand how to navigate integrative and functional medicine appropriately and not get pulled into what Jane did, the $2,400 worth of lab testing plus over a 10-month period, development of an eating disorder, and a total expenditure of $7,400 to feel no better. In fact, felt even worse. Okay, so here is the background. Jane is a 38-year-old female, previously diagnosed with Crohn's, although it's currently quiescent, thankfully, and SIBO. Her main symptoms were distension, diarrhea, brain fog, and fatigue. And I'll start you off with a quote right from Jane. Jane's not her name. We changed it for obvious purposes, but working with a functional doctor led to improvements in symptoms. But a few weeks into treatment, my symptoms came back, along with new bloating and distension, and I was told it was SIBO. So here's the workup that Jane underwent. And let me be clear in saying you may detect a degree of frustration in my tone, and that frustration is directed at the situation, not at the provider, not at her previous doctor. I think that the doctors in this field are doing the best that they can, but haven't fully pieced together that education in the field is heavily influenced by lab companies and also by supplement companies. And you see that here. Of the testing that she did, 3 of them are all from the same company. So clearly this company, you could infer, has done a good job in educating this provider as to why the tests are needed, absent to information as to how to use them or disclosing if the tests may not be validated. So let's look at this. The Vibrant Wellness Wheat Zoomer test, $400. A 88 diet antigen test, $360. The Dutch adrenal test, $299. A glucose breath test, $215. The Vibrant Wellness Gut Zoomers, there's Vibrant Wellness again, $599. And finally, the Vibrant Wellness Micronutrient Test for $539 for a total lab evaluation bill of $2,411. Now, maybe you could argue, well, if this is going to help me with my chronic symptoms, it's worth it. And I would say, yes, if it is going to help you. In this case, it made the individual worse, and I will help outline exactly how this happened. So first, let's start off with the food allergy testing. The promise here is promising. Well, what if food that I'm eating, unbeknownst to me, are causing inflammation and leaky gut and all of these symptoms? Well, okay, maybe, but this is not the case. The food allergy testing is not accurate and it is not helpful. And it's really important that we understand this. Now, as an aside, this isn't commonplace knowledge. It takes myself and a small research team to fact check and figure this stuff out early in my career, I did use these tests because I took the lab's word for it. Let's look at some of the evidence that showcases food allergy testing should not be performed. Starting off with a 2022 review paper in the Journal of Frontiers in Nutrition. And to quote, IgG antibodies, this is what is often used in food allergy testing, as opposed to IgE, which will tell you if there's an anaphylactic allergy. And I should probably distinguish that these anaphylactic IgE-mediated tests are valid, are helpful. Yes, this is not what is used when people are looking for chronic low-level food reactivity. IgG is often one of the antibody titers that is tested. So continuing, IgG antibodies to wheat, dairy, and eggs were not different between healthy and symptomatic participants. So no different if you were not feeling well and having reactions, or if you were healthy. So how could this possibly help you? Continuing, a study in the Journal of Nutrition and Metabolism, also from 2022, to quote, out of 28,000 healthy participants, 52% tested positive for IgG antibodies to various foods. And third and final point from the Academy of Allergy, Asthma, and Immunology, IgG antibodies to common foods can be detected in health and disease. This reflects the likelihood that circulating antibodies to foods happen in most normal individuals. It was therefore concluded that food-specific IgG testing should not be used. Now, to be fair, some labs also order IgA. I'm hoping this impresses upon you that one of the main facets of food allergy testing, IgG, is not helpful and occurs in normal individuals. And once you understand this, you can appreciate that, like I've shared on the podcast before, a very healthy person may come back with 20 food allergies, and a person who is quite ill may come back with 5. And very often, people remark, what the allergy test says I shouldn't eat, I feel fine on. And oh, by the way, there are certain foods I notice disagree with me, and the test says I can eat them. But let's continue developing this point. This kind of ties it all together, sadly. From Neurogastroenterology and Motility 2023, an observational study of 410 adults and 129 children with digestive symptoms, they found that a history of elimination diets was associated with a 3 times increased risk of developing a restrictive eating disorder, just like Jane did. So thanks for the lab bill, thanks for the inaccurate testing, and thanks for the eating disorder, right? This is what the labs have done thus far. Continuing, Jane had spent $7,400 when you lump together the testing and the supplement bill, and she developed an eating disorder. And here's another quote I took right from her chart, because I want to share this with you so you don't go down this same path. In 10 months of a strict diet plan and lots of supplements, I still haven't achieved the level of relief I had a year ago with just a few days of healthy eating. She used to respond very well to the Whole30 diet, a basic elimination diet that used no testing. And so now she's avoiding foods that I'm not allowed to eat. And those foods made me feel great last year. So essentially what she's saying there is she's now avoiding foods that she used to eat and feel well on, but now she's not allowed due to the food allergy test. So you see the underpinnings of the development of an eating disorder right here in this quote. Okay, so we've gone through these first 2 tests for food allergies and made a case that there's a really big I guess elephant in the room, if you will, that the IgG fraction of food allergy testing is not accurate and may lead to an eating disorder, just like Jane developed. What about the adrenal test? Well, if you're not feeling well, if you're kind of tired, we got to figure out what's going on with the cortisol. This is the promise. Again, done with good intention, but it's really misguided. Back to the Journal of Neurogastroenterology and Motility, to quote, and stay with me on this, a little bit wordy, but these findings suggest that the stress response, so mediated by cortisol, is a major driver of IBS symptoms. The time course of the beneficial effect of combo, this was a 2-strain Bifidobacterium longum administered at 1 billion CFU per day, on IBS symptoms suggests that this is achieved through a restoration of the stress response. Again, the time course of the beneficial effect of the probiotic on IBS symptoms suggests that the improvement was achieved through restoration of the stress response, as you are seeing here. Now, this graph, what it's showing is at time point 0, 4 weeks, 8 weeks, 12 weeks, and 16 weeks. What you're seeing at the first time point 0, is a suppressed or an abnormal cortisol awakening response. You should have a robust output of cortisol in the morning to get you up, get you out of bed, and get you on with your day. When you're not feeling well, as these IBS patients were not, who had IBS and also things like fatigue and poor sleep, which often happens, they had a suppressed cortisol awakening response. Now, I'm not a big fan of cortisol testing, but the cortisol awakening response might be the most accurate, probably is the most accurate. Now, what they found here in this research setting, they were not using these tests to treat the patient. They were tracking what happened to patients when they were given a probiotic. So at day 1, they started on that Bifidobacterium probiotic. And what you see here is a normalization at week 4 and week 8 of their cortisol awakening response. Yay! No testing, successful treatment, and the adrenal hormones take care of themselves. But look at this. They stopped taking the probiotic after the 8-week mark, and slowly, week 12 and week 16, you see a regression back to their suppressed cortisol awakening response. So what this tells us is that a successful gut intervention that improved the IBS symptoms, in this case a probiotic, will take care of the cortisol levels. So do we need to spend $300 on the Dutch adrenal test? And do we need to expose this person to additional fear? Right? Imagine yourself in Jane's shoes. I'm not feeling well. I think something might be wrong. I'm getting kind of concerned. Let me do some food allergy testing. Holy smokes, as I'll share with you in a moment, I need to avoid 37 foods. I don't even know if I eat 37 foods. And Jane was told, well, your gut's so messed, presumably your gut's so messed up, you've got to come off all these foods. Your gut is so leaky, you're so reactive. Okay, so process all that emotionally and financially. Add to that the adrenal test, which I'm sure did not come back looking normal. Oh, Jane, you gotta come off caffeine. You gotta meditate more. You gotta reduce your exercise. Right? All this stuff is just piling on from a psychological perspective. All of these straws on the camel's back, eventually it will break, and in this case led to an eating disorder. But let's continue. A glucose breath test for SIBO and also a gut zoomer test for dysbiosis at $215 and $599 respectively. Well, what you're looking at here are 2 meta-analyses looking at probiotics for treating SIBO as compared to rifaximin for treating SIBO. Now, why this matters is you will often hear, well, we've got to know if it's SIBO, because if it is SIBO, we should avoid probiotic, which is so wrong, and we can give you rifaximin or herbal antimicrobial therapy. Look at this. Again, these 2 meta-analyses. So this is not a cherry-picked clinical trial or my sort of mechanistic speculation. These are meta-analyses. And what you're seeing is a 63% clearance rate of SIBO with probiotics in the one meta-analysis and a 59% clearance rate of SIBO with rifaximin in the other meta-analysis. So a similar level of response for SIBO with either probiotics or rifaximin. So why do we need to order a test if we know all of these therapies work? Further, a 2019 clinical trial took one large group of IBS patients, half of which had SIBO, half of which did not. The group that had IBS and SIBO had a 71% response rate to probiotics. The group with IBS and no SIBO had an 11% response rate to probiotics. So you literally see better results with probiotics if you have SIBO. So the utility of the testing here breaks down even if SIBO breath testing is valid. And this really matters because of Jane's previous experience with probiotics. So she tried a lactobacillus and bifidobacterium blend type probiotic. Look at the note here. Her ND was very hesitant, had her only use it as an enema at first. So poor Jane. Can you imagine what is happening to this poor person psychologically, where she's being told, you've got SIBO, we've got to be really careful. I'm apprehensive about a probiotic only as an enema at first. Can you imagine going through this where you now have to go buy a tube to shove up your butt and an enema kit and go through this whole process? So unnecessary and so damaging psychologically. But nevertheless, either via enema or just taking it as a capsule, she noticed probiotics were helpful. That's a shock. Why would we have to be so careful? She also tried a soil-based probiotic, also helpful. And finally, she tried a Saccharomyces boulardii probiotic, and additionally, this was helpful. In fact, she remarked each time she added a probiotic, she improved. And I believe she was reading some of our materials that breaks down the probiotics into 3 different types, and she was trying them one at a time, and she was seeing benefit all the while. I think this is part of the reason why she came over to the clinic, because a therapy that was helping her was one that her ND was really apprehensive about. And clearly, the ND wasn't helping. And again, I think the ND was trying to help, but nevertheless, being fed a lot of inaccurate data to Jane's detriment. So, coming back, I think we've made a case that the glucose SIBO breath test, even though that is a validated test, wasn't really necessary and also probably did not help her psychologically. And also, if it was interpreted as be careful or avoid probiotics, then that's an egregious misread. And we've also discussed that dysbiosis testing has not demonstrated the ability to inform how to treat an individual. So the need for this $600 Vibrant Wellness Gut Zoomer test is a goose egg. Okay, let's go to the final test. Again, Vibrant Wellness, a micronutrient test for $539. Underneath the assumption, well, maybe part of the reason why you're not feeling well is you have low B vitamins or low iron or what have you. Understandable until you look at some of this data. A meta-analysis in the journal Nutrients, which, by the way, I'm proud to say that myself and our clinical team has published in this journal. It's not this paper, but we published a different paper in this journal in 2022. Now, this systematic review with meta-analysis found that probiotics led to improvements in B12, folate, calcium, iron, and zinc. So, do you have to start with micronutrient testing? Probably not. And one more test, a clinical trial that looked at what happens to female athletes. Female athletes have a tendency toward low iron. What will happen if we take half of these female athletes who are low iron, we give half of them an iron supplement plus placebo, we give the other half iron plus a symbiotic, which is a combination of probiotic and prebiotic. And as you can see here, over an 8-week follow-up period, the group taking the symbiotic, so iron plus the symbiotic, had vastly better levels of serum iron than did the control group. So one more data point showing that a successful gut intervention will help with absorption of nutrients, And if you're supplementing with some type of vitamin, will also improve the absorption of that vitamin, thus making it probably unnecessary to use this sort of testing when someone is still having active gut symptoms, because if you focus on the gut, you will improve absorption of the micronutrients. So this brings us full circle back to the $2,411 she spent, the $7,400 total expenditure over a 10-month period. And what happened? Well, she didn't feel better. She felt worse. She avoided more foods. She developed an eating disorder. And that was probably underlined by the fact that this person who was struggling physically and psychologically with not feeling well saw all of these problems on her lab work, which most of them are BS, as we detailed, and developed a unhealthy psychology, tipping her over the edge, breaking the camel's back into an eating disorder. And it's this sort of thing that I am so passionate, and we at the clinic are so passionate about helping you avoid. And to the doctors watching this and the clinicians watching this, I understand where you are coming from. Many of these tests I used to routinely order. And I'm very grateful for the fact that myself and a small research team are working together to fact check these things and bring to you better data and better information. You can help your patients more with less testing, because look at what happened in this case. The testing led the clinician down the wrong path and also contributed to psychological issues in this patient, leading to an eating disorder. So we want to help patients, yes, but we have to understand that lab companies, just like pharma companies in conventional medicine, have become far too pervasive in their influence of education. We have to do better. Patients deserve better than this. I understand that the testing offers a promise, but so often, as I'm hoping I've helped you to see, that is a false promise. It is a promise without the requisite evidence. And these cases are living, breathing, suffering examples of that false promise. So if you're a clinician, please rethink and fact check the tests that you're using. And if you're a healthcare consumer or a patient, please be wary if you are advised to do many tests, because as you see here, oftentimes they actually lead to worse outcomes. Please let me know what you think in the comments below. This is Dr. Mike Ruscio, and I really hope this helps.